Today, I'd like to talk about autologous rib cartilage. As you may know, autologous rib cartilage is considered the ultimate material for nasal surgery. It's truly an excellent material. It's your own biological tissue taken from your body, it's firm, and most importantly, there's a large quantity available. While septal or ear cartilage is sometimes harvested, especially ear cartilage, in many cases where autologous rib cartilage is used, you often don't need to use ear or other types of cartilage at all. That's how much you can harvest a sufficient amount. Of course, there can be individual differences. Now, I'd like to talk about using this excellent autologous rib cartilage in a primary surgery. Well, actually, autologous rib cartilage is such a good material for nose surgery, but since it has to be harvested from your own body, specifically from the chest, it has traditionally been used mainly in difficult cases like revision surgeries, contracted noses, or reconstructive surgeries. But recently, the use of rib cartilage in primary surgeries has been increasing significantly. Let me explain in 3 points about the situations in which rib cartilage is used in primary surgeries. First, there are cases where the patient's own available tissue is too little or too weak. Usually, we check the size of the septal cartilage with a CT scan before surgery. If the septal cartilage measures at least about 30 millimeters in both width and length, we generally consider that sufficient. However, if it's smaller than that, we need to give it some thought. Second, there are cases where, although the patient hasn't had nasal surgery before, they've had other surgeries that have affected this tissue. For example, some people have had septal deviation surgery at an ENT clinic or similar place. Septal deviation surgery, as the name suggests, involves removing the curved part of the septal cartilage. In that case, the septal cartilage that we could use as material would no longer be available. Since the amount of material is limited, you may need a new and better material. Next, the second case is when someone has had double jaw surgery. In these cases, the reason it affects the nose is that during double jaw surgery, the lower part of the septal cartilage is often damaged. In these cases as well, you may need more and better materials. Lastly, the third case, and actually this is the most common these days, is when someone wants a high and striking nose. In such cases, autologous rib cartilage can be a very good material. Also, if you want to improve the nasolabial angle, it can be useful for that as well. Correcting the angle is called nasolabial angle correction, and these days, moving the recessed area forward is commonly referred to as nasolabial angle correction. But to really improve the nasolabial angle, you need to bring the upper part of the philtrum forward quite a bit, so you usually need a firm and high quality material. If you like a high and striking nose like this, using autologous rib cartilage from the start is actually a way to avoid regrets. If you shape it to the maximum height from the beginning, there's almost no chance you'll be disappointed because it's too low. In such cases, I also think using autologous rib cartilage is a good choice.
Autologous rib cartilage is an absorbable material, right?
There are many people who ask about the absorption of autologous or donated rib cartilage. In fact, autologous rib cartilage is hardly absorbed at all. Of course, a very, very small amount may be absorbed, but it's really well preserved, and you can say that there's almost no absorption.
You'll end up coughing, sneezing, or blowing your nose. After surgery, is it better to hold back from doing these things for a few days?
A lot of people are worried and curious about sneezing, but sneezing once or twice is fine. It's not a problem. Actually, even if you do it several times, it's not a big issue. Unless you happen to bump into something quite hard or experience a major, significant accident. Honestly, if merely coughing or simply yawning a few times could potentially cause problems with your nose, then you really, truly shouldn't be having surgery in the very first place. So, I genuinely don't think you need to worry about that particular aspect too much at all.